coronavirus, we're turning to the experts to give you just the facts and not spread fear. I know you've heard us say that so many times, but it's really our motto here. And you can send us your questions anytime by texting the number on your screen, 503-226-5111. And one of our go-to experts who's been answering dozens and dozens of your questions every night is Dr. Claire Wheeler with PSU and OHSU Public Health Specialist. Dr. Wheeler, I feel like you're turning into my co-anchor here at 7 o'clock.
I love it. It's great. Thank you.
And you're helping so many people. All right, so our first question, we keep getting all of these, comments from viewers. Everyone having questions about, what can I do? What can't I do during this stay-at-home order? A lot of questions like, can I go see my relative? Can I go see my family member? Can we go on a car trip? But isn't that really against the entire point of the order? I mean, shouldn't we really just be staying home?
Yes, we should be staying home, and I'm really grateful that the governor and local government and everyone has come together finally and issued this stay-at-home order to make it very clear, and also to I think just demonstrate the severity of this situation. We have to do everything possible to minimize the number of people showing up at our hospitals every day, and the only way to do that right now is to just stay home.
Right, just stay home. We've also been hearing this argument from people. We got an email today. The person said, there are more fatalities on the highways, many of them innocent victims, than the coronavirus. The person said, we never shut down all the highways. Why are we shutting down all the businesses for a relatively small number of people who might die from COVID-19? The person said, I'm all for compassion for those infected by the virus, but what about compassion for business owners? I mean, as a medical professional, how do you respond to that?
Well, first I take a deep breath and center myself and really, have to remember the fact that non-physicians, I think it's maybe a little bit more difficult to really imagine what this situation truly is like in the healthcare setting. But if you think about our healthcare system as, let's say, your budget, right? We know pretty much how many car crashes are going to happen every year. We know how many people are going to get the flu, more or less, give or take, every year, right? So our entire healthcare infrastructure is built around what we have learned to expect every year. And then if we have enough foresight and enough resources, we have a little cushion on top of that for unforeseen things like an epidemic and a particularly bad flu season or maybe a natural disaster, right? Mm-hmm. So we're always running at around 80 to 90% capacity with the heart attacks and the car crashes and every other health emergency that happens. But now what we're talking about is replacing or overwhelming that little margin of error that we have in our system that isn't nearly enough to take care of everyone who's going to get this illness if they all get it in the next month or so. And yes, business is going to take a hit, and that's why Congress and they're moving ahead with financial support. But the worst possible thing we could do is ignore these stay-at-home orders and overwhelm our healthcare system. But also, we have police, for example, police departments in places like New York losing 5 to 10% of their officers to this illness. So there's a lot. This is a ripple effect. And the only real way that we have right now to manage this and be able to cope with it with the infrastructure we have in place now is to stay home.
And Dr. Wheeler, a lot of questions about masks. A lot of viewers have asked, why can't they be sterilized? There are many different ways you can sterilize different items. Why can't they be sterilized so they can be used again?
Well, so there's a couple issues here, and one of them is I actually have this left over from when I was painting or doing some household project. But I just wanted to share this because look, there's foam in here, there's metal to make it fit on your nose, there's elastic there. So it's not only a matter of contamination, it's about all of these different pieces wearing out. And as you know, if you launder your clothes, that makes them wear out. So various types of cleaning are not practical. Also, most of healthcare is based on a single-use and throwaway system for just about everything from IV tubing to mask to everything else. So these things are not built for multiple use. And at some point, the filtration isn't going to be as effective. Now, the other thing is an N95 mask is different because it's a seal all the way around, and you're only breathing through that little round filter at the front. That's what our healthcare professionals really need, and that is something that those of us out here in the community really don't need right now.
Exactly. All right, Dr. Wheeler, thank you so much again for joining us, always providing such great perspective, and I know we'll see you again soon, and we'll keep sending you all of these viewer questions. Thank you so much again.
My pleasure, and thank you for doing this for everybody.
Of course. So moving on, so many of us are wondering how long we'll be living like this, with social distancing, working from home, interviewing experts at their homes. I talked with an infectious disease specialist at Adventist Health about his estimate on the timeline.
I look at the China epidemic curve, and I still see they're just cresting after more than 3 months. And so I do think we're definitely in for another 3 or 4 months. Now, does it have to be the same intense measures? I don't think so. I think we could probably do this for 2 to 3 weeks, and hopefully we can start relaxing on this in as much as not having as strict measures.
And what about our more vulnerable members of society, those dealing with addiction and homelessness? I talked with an NBC medical contributor, Dr. Libby Roy, about if the rules from staying home could hurt efforts, to really care for those in need.
Yeah, that's such a great question because, shelter in place or the hashtag stay at home, it works for people who have homes. But what about people who are living on the streets, who are, hopping in and out of homeless shelters, who are living under bridges? It creates a lot of challenges. And I was a former primary care doctor to homeless men and women in Boston for many years, and I saw firsthand both the many acute and chronic illnesses that are experienced by men and women who are homeless. In addition, the illnesses such as drug addiction, alcoholism, and incarceration, these are all issues that are disproportionately affected, that affect or impact people who are homeless. So, there's nothing like a healthcare crisis or a pandemic that'll really expose or highlight the additional risks to our most marginalized populations. So we need to take particular care of these men and women.
It's the big problem here in Portland and in Oregon. What can people do? What can the people do, if anything, to protect those populations?
Yeah, so I would start by watching what other cities and states are doing and counties are doing. New York City and Boston, for instance, have two very large homeless populations. And what Mayor de Blasio in New York is planning is he's working with local hotels to open up spaces. He's working with university campuses to create both clinical space and space for our marginalized populations. So there's a lot of creative solutions, but we most definitely have to reach out to men and women who are living out on the streets, because it's very difficult for them to practice physical distancing. Mm-hmm. So we need to reach out to them, make sure that they practice the appropriate precautions and get the care that they need.
Up next, 2 Oregon postal workers have coronavirus. So what can you do to make sure you're handling your mail safely? But first, here's another quick question. It's the mask question again. Do you wear a mask to keep from getting the coronavirus, or should you only wear a mask if you have it? The answer: masks are best used by people who are already sick to protect those around them, but really, it should be worn. They should be worn by healthcare providers.
Please give to the KGW Great Food Drive going on now.
After 2 Oregon postal workers tested positive for coronavirus, that has people wondering if their mail is safe. Kyla Boshi looked into how to handle your mail safely.
The Postal Service maintains coronavirus cannot be spread through the mail, citing various sources, including the CDC, World Health Organization, and U.S. Surgeon General. But a recent study found coronavirus can stay on cardboard up to 24 hours. So if you're worried about it, you can wipe down the surfaces to disinfect them. Also, here's what's really important. Wash your hands and avoid touching your face and mouth after discarding the packaging.
So several viewers wanted to know, how can people report businesses that remain open that are on the mandatory COVID-19 stay-at-home closure list, according to Governor Brown? Well, you can file a report with OSHA online at osha.oregon.gov. You can also find that on our website. If you're in Portland, you can call the Portland Police Bureau's non-emergency line to report violations. That's at 503-823-3333. And you can also reach out to BOLI. That's the Bureau of Labor and Industries here in Oregon. All right, our next question, what are the recovery rates and percentages for COVID-19 patients? So according to the doctor we've been consulting with for so many of these questions, that's very dependent on the patient. So the age, previous health status, gender. Research shows that more men are dying from this than women, smoking status, and the list goes on. In one study from China, of 191 people sick enough to go to the hospital, 54 of them died in the hospital. That's 25%. Risk factors for death included older age. And our next question, do we know if there are any after effects of COVID-19? This viewer said that they hear it can cause lung damage. Is that true? So according to doctors, this is brand new. So we don't know for sure what the long-term consequences of infection might be. However, we do have information from seasonal flu outbreaks and the SARS outbreak of 2003. People who were hospitalized in that outbreak, that is people who got really sick and survived, they experienced scarring of the lung, which can make all future respiratory infections more dangerous. Doctors also say any virus or bacteria that infects the lungs will damage the lungs. Please keep sending your questions. We are doing our best to answer them, and every single night at 7 o'clock, we're dedicated to answering as many of your questions as we can. Up next, are you wondering what disinfectants to use to fight the coronavirus? Our Verify teams look into what works best. And here's another question and answer for you. Can the coronavirus live in the outside air? And if so, how long? The answer, a recent study found the virus could be detected in the air for up to 3 hours.
Viewer Auntie Melanie tweeted us asking, what kind of disinfectant solution can we use on surfaces to fight the coronaviruses? And she gave a list of a few specifics. Great question, Auntie Melanie. Let's find out together. Our sources are the CDC and the Environmental Protection Agency. So when we dug into this, we found a CDC page that highlighted diluted household bleach and alcohol solutions with at least 70% alcohol. So that's 2 on your list to check out. Just make sure the alcohol is higher than 70%. The CDC also linked to an EPA page we want to share with you. It's a list of disinfectants for use against this current coronavirus strain. It has 287 cleaners that have been shown to work and how long they need to be in contact to be effective. You can search by ingredients or brand. So from Auntie Melanie's list, hydrogen peroxide is approved. 39 different products using it all popped up. Make sure you check which one you have. Some only take 2 minutes, others take up to 10. Neither betadine or pine sol showed up in results though. We're not crossing them off, just leaving them as questions, because the EPA site does say that additional products could be added. So we can verify. Bleach, hydrogen peroxide, and alcohol, above 70%, are all effective at destroying the coronavirus. And there's a list of hundreds of other products that work as well. Check your products on that EPA site to make sure they're effective. We'll have a link to it on our website as well. One quick note though, hand sanitizer doesn't show up in this list because they're actually regulated by the FDA. As long as your hand sanitizer is 60% alcohol or higher, you're good to go. Folks, if you got any other questions like this, shoot us an email. With your Verify, I'm Jason Puckett.
Up next, money is a huge concern during this pandemic. We'll break down what the government's stimulus package means for individuals and small businesses. But first, here's another question. Is there a risk of coronavirus spreading from mosquito bites? The answer is no. It's not a blood-borne pathogen. In order to cause this disease, the virus needs to have access to the airways or to the gut, where there are cells that have the handle that the virus needs to latch onto in order to cause infection. So the short answer there, no. Right now, Congress is working to pass a $2 trillion corona relief package, the largest in U.S. history. But there are so many questions right now. What does that mean for families, those unemployed, and small businesses? Lindsay Nadridge has those answers.
This relief package is more than $2 trillion. So it includes billions for corporations and hospitals, but it also means almost all of us will get money as we try to get through this until things reopen. So if you make $75,000 or less, you'll get a check for $1,200. If you're married and as a couple you make $150,000 or less, you'll get a check for $2,400. And if you have kids, you'll get an additional $500 per child. And if you have direct deposit with the IRS, you'll get that check faster. Today, though, the White House said we should see this money in about 3 weeks. Now, a lot of you are asking, do we have to pay taxes on this? Today, I spoke to a state economist who said we do not have to pay federal taxes, and as far as he knows, we won't have to pay state taxes either unless the Oregon legislature takes some action to collect taxes, but for now, we should not have to pay taxes on that money. This will also boost unemployment insurance benefits, which is good news because the employment department says they're seeing a record number of people apply for unemployment insurance benefits because thousands were laid off as things are closed. It will also expand who's eligible to get those benefits to include people who are self-employed and work in the gig economy. And it also means people will get an additional $600 a week for 4 months on top of what the state is already paying. And finally, for small businesses, it would create a more than $350 billion loan program. And if businesses can keep workers employed through this, a lot of those loans could be forgiven. Of course, we have much more on this on KGW.com. I'm Lindsay Nadrich for KGW News.
Great information from Lindsay there. Thank you for doing that. And of course, there are scammers out there trying to take advantage of all of this fear and uncertainty. But what is the most common scam that you need to be aware of? For that answer, we turn to Ren Cannon. He's a Portland FBI special agent in charge.
One of the first things they need to be careful of is unsolicited emails that carry links. So an example might be something that purports to be from the CDC that says, hey, check out this link. It shows where the virus is spreading. If you receive an unsolicited email with a link on it, you need to make sure you verify who sent that to you and verify the link, because clicking on that link could open your computer to viruses that could include ransomware, surveillance software, and other viruses that could steal your financial information. And later on, that could be used for identity theft or for ransomware to lock up your computer, make you pay a ransom to get your photos and things like that from your family computer. So the first thing is be very careful of the links, especially if it's coming from an unsolicited email.
Okay, be careful of those emails. Thank you so much for joining us tonight. We are back every night at 7 o'clock to answer as many of your questions as we can. You know, we may have answered some of your questions already in our past stories. Go to kgw.com/facts-not-fear to look at some of our work that we've done on this topic. We'll see you back here tonight, 7 o'clock. Keep those questions coming.